afternoon, I go to talk about anatomy of TMJ and treatment of TMJ disorders. The masticatory system is a functional unit of the body. It's primarily responsible for chewing, speaking, swallowing, tasting, and breathing. The masticatory system is extremely complex. It's made up primarily for bones, for muscles, for ligament, and teeth. Movements are regulated by an intricate neurologic controlling system. Each movement is coordinated to maximize function while minimizing damage to any structure in the TMJ. The temporal mandibular joint is located anteriorly of the tragus in the ear, on the lateral aspect of the face. The temporal mandibular joint consists of articulations between three surfaces from the temporal bone and the mandibular bone. We have to know that the joint stability and movement is produced for many coordinations of contracting muscle tissues and non contracting tissues. That this permit motion and transmit force produced by muscles. We have to know that muscles are capable of opposing as well as imparting motion. No other joint is as a dependent upon of this coactivation of muscles growth as is the TMJ. For this coactivation, this joint is called the most active and complex joint in the body. Due to the complexity of the masticatory systems, TMD disorders, symptoms, TMJ disorders, symptoms may be caused for different physiological and psychosocial factors. We have malocclusions, interference in the occlusions, alterations in the movements of the muscles, like parafunctional habits from different patients. We have to know what are we treating. We have treating pain from muscles, from the articular tissues like capsule joint ligaments. We have treating altered function like clicking, catching, like locking aberration in form, like it's called TMJ dysfunction. The different range of motion, we have the hypermobility and hypermobility. And word dentition from the two weird, like we have to know the abrasion, erosion, and abrasion. The word dentition is bruising relate, erosion chemical, biorelate, functional weird.
Yeah. Today we're going to talking about the TMD etiology. TMD etiology is the causes of the temporomandibular disorders. What's the causes of the temporomandibular disorders? We will start with the definition. The definition of temporomandibular disorder is a group of painful and dysfunctional conditions related to the muscle of mastications and temporomandibular joints and its related structures. There is different etiologies and multiple causes that will lead to the TMDs. A lot of researches have been done to just figure out the causes of the temporomandibular disorders. There is factors divided to three types. Factors. First of all, we have predisposing factors, and then we have precipitating factors, and the last one is perpetuating factors. We're gonna talk of each of one side. The predisposing factors, they are all the factors that will lead to the disorder. We don't have the disease now, but we have the risk factors. The other name of these factors is the risk factors. The factors that will lead to the disease. The disease will not start yet. There are four types: the systemic, the psychosocial, physiologic, and the structural. The systemic one will affect the entire body, the whole body, or specific system in the body itself. And the psychosocial, it's interaction between the psychological factors and the social factors. While the physiologic, the cellular and metabolic process or neuromuscular factors. And the last one, the structural factors, is about dental occlusion, musculoskeletal factors, and articular development anomalies. Now we have the precipitating factors, the factors that will cause or accelerate the disease. Now the diseases start, and now we have these factors that will accelerate or make the disease or the disorder even worse or even bad. We can call it also the initiating factors, the reason behind the onset of the disease or the disorder. And which are involved trauma or abuse, will cause trauma or like parafunction for the TMJ. Repetitive activities of the jaw with sustained or abnormal postures or under abnormal load, like when we playing with some musical instruments like violin or wind instruments. And the last one, the sleep postures. All the sleep postures play an important role. It will lead, or it will maybe lead to TMD disorders. TMD disorder. Okay? Yeah. That's good.
Good, very good.
So today we will talk about TMJ examination. In TMJ examination we have three things. The first of all, why to make the examination. The second thing is we have to listen to the patient, and the third thing, the clinical test that we have. So why to make the examination? First of all, to reach the correct diagnosis. And as we know that the true diagnosis is the half of the correct treatment plan. And the other thing is that something specific just for TMD problems is that when the patient, most of the patients who are not having any symptoms of TMD problems, having a real signs of a TMD problem. So because of that, we have to make the examination for the patient to check if there is an TMD problems or not, even if the patient is not complaining. So, and the second thing that we have to talk about today is listen before examine. We have to listen to the patient, know what is the chief complaint of this patient, why he is coming to the clinic. And the other thing is that in TMD problems, half of the information that we got from the patient is by listening to him, because most of it is a sensation. It's not something we can see by our eyes. And the third part of this presentation is the clinical examination. The clinical examination, we are talking about the test of the joint itself, test of the masticatory muscles, and also the test of the oral cavity. And we have to consider also in the clinical examination the sleep problems, and the other thing is the parafunctional habits. So let's start with the temporomandibular joint test. For the joint itself, we have 6 tests, which is the range of motion and the sounds, the palpation of the joint itself, and loading test, synovial test, and finally the compression load. So let's start talking about the range of motion. In the range of motion, we have to consider the maximum mouth opening, the lateralities to the right and left, and the protrusion of the mandible, how much we can protrude the mandible. So, the maximum mouth opening. Things that we have to consider in the maximum mouth opening. First of all, that we have the passive and active. The difference is that the active one is that when the patient opens his mouth, what is the maximum? The passive one is when the clinical or the dentist try to open the mouth beyond the maximum opening. And the other thing is that the mouth opening is changed with age. Like the younger patient has a smaller mouth opening than the older ones. Third thing is males have a wider mouth opening than females. And the last thing that it varies with the skeletal type.